About 4 years ago, my aunt was diagnosed with stage 4 colon cancer. It was a very hard time for her and her friends and her family. I was there with her, and she was always sick and weak and rarely had a good day. She passed away almost 2 years after she was diagnosed, longer than her doctor had expected. I will inform everyone on what colon cancer is, how do you know you have it, and what are the treatment plans. Colon cancer is a very deadly disease. The colon is the final part of the digestive tract. It begins as small, non-cancerous clumps of cells called polyps. Over time, polyps become cancerous, and they form on the inside of your colon. Another name for colon cancer would be colorectal cancer. This is because it combines two words, which is colon and rectal. This is what the colon looks like. And these are what colon polyps look like that form on the inside of the colon. I got this information from Mayo Clinic on disease and conditions in coloncancersymptoms.com. How do you know you have colon cancer? You begin to see a persistent change in your bowel habits. For instance, diarrhea, constipation, and change in consistency. You also begin to see some rectal bleeding, this being blood in your stool. There will also be a persistent abdominal discomfort, for instance, cramps, gas, and pain. You may also begin to feel like your bowel doesn't empty completely. And another symptom will be weakness or fatigue, or unexplained weight loss. These right here are colon cancer symptoms. This is nausea, fatigue, weight loss, weakness, constipation, dark stool, diarrhea, rectal bleeding, painful bowel movements. Right here, you can see where it's dark red. This is at the end of your digestive tract. I got my information from the Colorectal Center Types of Treatment on cancer.net. The next step is treatment. The treatment depends on the size, the location, and how far the cancer has spread. My aunt had stage 4. Then surgery is another type of treatment. This is lymph node dissection. This is you surgically remove the lymph node. Another type of surgery is colectomy. This is where you surgically remove all parts of the colon. This is what my aunt did when she was first diagnosed by her doctor. Then medication is another treatment you may choose to go on. As everyone knows of, chemotherapy. This is when you use unwanted drugs to kill cancer cells. My aunt did this after her surgery, and I went to her to all her chemo appointments. Common chemo drugs, and excuse me for how I pronounce them, is Fulfry, Fulfox, Capecitabine, Fulfuracil, oxaliblation, irinotecan, and Pseudomex. And then there's also another type of chemo called a protective drug. This is leucovorin. This reduces the side effects of chemotherapy. And lastly, radiation. This is when you use high energy X-rays to destroy cancer cells. And these are colon cancer treatments: surgery, chemotherapy, and radiation. Surgery, the procedure includes removal of colon tumor and nearby lymph nodes. Chemotherapy can be given through pills or in capsules or through the intravenous tube. And radiation, high energy X-rays, are used to destroy the cancer cells in radiation therapy. I being the reference, because I, the niece of the cancer patient, went with her to her chemo appointments. So, in conclusion, colon cancer is a very deadly disease and produced very few symptoms. When my aunt was diagnosed, it was a very hard time for her and all her friends and family. She fought hard and she had surgery and did chemotherapy. She survived longer than her doctor had expected, but she is mysteriously but in a better place. I hope you learned something about colon cancer and how to detect it and what are your treatment plans. Thank you.